Now, the president's expected to create a task force, this is later on today, actually in about a half hour, a task force designed specifically to combat the growing opioid crisis. Fox News medical correspondent Dr. Marc Siegel, he's been on the show before saying, look, partially it's doctors' fault for this epidemic. I've got a quote from his latest article in the Wall Street Journal. Here's the quote. 4 out of 5 heroin abusers started with prescription painkillers, presumably given by a doctor. Marc Siegel joins us now. Okay, I take your point, and you've made your point very frequently on this program. What can the government do about doctors who are overprescribing painkillers?
They can do a lot. First of all, yes, because first of all, it's a two-tiered problem. Let's, of course, stop the flow of illegal drugs across the border. But as you just said...
Well, that's not opioids.
No, but that's heroin, and that's where it ends up. Half of the drug overdose deaths are heroin, but they get there, and back to your point, look, they get there in the doctor's office, Stuart. Yeah. So here's what you do in the doctor's office. 50% of those prescribing these opioids are primary care doctors like me that have no business doing this. You know, I see somebody with back pain. I may not know what it is. I might not have the ability to diagnose it properly. Patients complaining, give me something, give me something. I give them Percocet or Vicodin or Tylenol and codeine. The next thing I know, they're asking for more and more of it. And I can't stop that parade. And I still don't know what the back problem is.
Well, isn't there something else that's not addictive that you can prescribe in place of opioids? Isn't there?
Absolutely. Many other things. Most of the time, it's a muscle spasm. I can prescribe a muscle relaxant, something like Xanaflex,
but does it
something
work?
like Flexeril. It works if it's a muscle spasm. I can get to what the underlying problem is. There's other medications, things like Neurontin, things like Lyrica. There's Advil. There's physical therapy. There's heat. There's chiropractic that's sometimes useful, manipulations. There's so many different ways to approach this before you get to opioid. And I'll tell you the worst part. Opioids don't even work for this. They mask the symptom. They're not getting to the underlying inflammation of muscle or bone
or nerve. What the patient wants is pain relief, and they want it now. And opioids give it to them. And they're going to say to that doctor, give it to me, because I want it, because I'm dying of pain here.
Okay, I'm going to give you one thing that works just as well as opioids. I still don't like it. If I inject the back with steroids and a painkiller, it will take the pain away just as well as an opioid will. The problem with the injections is they wear off too. But they're a heck of a lot better for you than the opioid is.
Okay, what do you say to this?
Acupuncture works. Losing weight works. Posture works. Orthotics work. Heat works. Physical therapy works. Primary care doctors are the culprits here because we're not supposed to be prescribing this at all. Thank God some states are really cracking down on this. In New York State, I have to go online. I've got to put my name on this. I've got to do it all electronically.
Wait a second. I've got one last. I've only got 30 seconds.
We're killing people. We are killing people.
Well, can't we bring the lawyers in to sue the doctor who prescribed too many opioids or sue the makers of the opioids in the first place? Is there something wrong with that?
I think cutting down on prescribing, cutting down on the pharmaceutical companies making so many of these, that's number one. Doctors, of course, should be policed. On this show, we've talked about New Jersey doing just that. 31, because here's the big point. Most of it is done by just a few of us. There's one guy in New Jersey prescribing allegedly more than 60,000 opioids for patients he hasn't even seen. And parents begging another doctor, begging him, we know our child is a drug addict. Please stop prescribing this stuff.
So you think
these people should have their licenses taken away? Maybe put in jail.
That's your primary answer. Go after the doctors who are over-prescribing and improperly prescribing. That's the main point here.
Yes, and as Governor Christie said today, let's get the treatment centers working, too. We don't have enough beds. So when you have the problem, let's take care of it with peer-to-peer counseling, 12-step programs. Let's get families involved. All of that's true, but let's prevent the problem in the first place.
Okay.
By getting the doctors. Let's police the doctors.
I hear you, Doctor. It's a serious problem, and that's a fact. Dr. Marc Siegel, thank you, sir.
Thanks, Stuart.
All right.